You're connected to San Diego's late news leader. This is 10 News Live at 11.
But first, a family sues over the death of their anorexic daughter who they say was responsible. A case will soon go to trial arguing one of the hottest new controversies in medicine. It's health insurance coverage for people suffering from what can be a deadly mental illness. 10 News reporter Marty Emerald investigates.
Brian and Mary Smith are on a mission to honor their daughter, who died suddenly 2 years ago.
She purchased a bottle of vodka and 150 Tylenol pills.
Their daughter Janelle took her own life to escape a terrible eating disorder, anorexia.
This is a fatal illness. This is 10% of anorexics die.
The Smiths say Janelle, a special education teacher, gave up on life after her insurance company pulled the plug on her.
Our district paid insurance premiums for unlimited coverage. They didn't provide that.
Here's Janelle's health policy from Magellan Insurance, offering unlimited coverage for serious mental illnesses, SMIs, including anorexia and bulimia. The family claims Magellan reneged on the deal, kicking Janelle out of the hospital where she was being treated. The Smiths also say this was done over objections from her doctors.
They called Friday to say she's being discharged on Monday. I protested. And then I said, she doesn't even weigh enough to qualify for an outpatient program.
Janelle killed herself 3 days later.
What they did was horribly wrong, and it took away our daughter.
The Smiths are suing Magellan over Janelle's death.
It was unlawful. It was in bad faith.
The Smiths' attorney says his medical expert calls Magellan's decision unreasonable, woefully deficient, oppressive, and fraudulent, far below industry standards. Attorney Scott Glovsky says the Smiths are not alone. He claims many insurance companies are shortchanging anorexia patients.
The more care they deny, the more money they make. This is especially true for diseases like anorexia that are very expensive to treat.
This despite the fact that California is one of 11 states that requires insurance companies to treat mental illness like any other physical disease.
We're seeing the best of the ugly world.
Attorney Harvey Levine, an expert on insurance law, says consumers need to demand more accountability from their insurance carriers.
I would just love to see groups a little more active in teaching people how to punish insurance companies that act wrongfully like this, with the one bit of power you have, and that's the power not to buy their product.
While the Smiths and their lawyers say they were denied coverage, Magellan says that's not true. A spokeswoman says Magellan paid all they were asked to pay and would have paid more if Janelle's doctors had requested it. This case is scheduled to go to trial next Friday. I'm Marty Emerald, 10 News.
For more on eating disorders and insurance issues, go to our website, 10news.com. There you can also learn about the upcoming National Eating Disorders Week.